I'm here to replace Brittany. I'm a birth and postpartum doula. I'm also a mother of 7 children. And so I've been on both ends of the spectrum, and I know how healthcare can be very biased, and I've been stereotyped and generalized. I've been accused of drug seeking when complaining about back pain while pregnant. I've been chastised for calling an ambulance when I was pregnant with my twins because of the preterm risk, because they automatically assume, well, you shouldn't call the ambulance, you should find a ride or something like that, just assuming things about me. And so I, as a birth and postpartum doula, I come in and I notice a lot of Black women feel much more comfortable with another doula who is also Black, and they feel that they come from their experiences and they understand their experiences. And I really push for more funding for doulas, but especially to help Black women who are interested in becoming doulas to be able to go through the programs, to get the training, as well as lactation. I'm a certified lactation counselor and breastfeeding. There is a lot of young Black women who are interested in breastfeeding, but they are assumed that they won't be. They are automatically given bottles and things like that, and they have no one that come in and advocate for them and really just come from a place where they are coming from and understanding. And so I work through an agency, the representative left, but you can also, doulas do also get paid through agencies, but then you can also go through community. And so I do community work through a community center, and I try to see as many as I can. But I wish there was so much more, because I hear so many heartbreaking birth stories of, forced C-sections and epidurals that are still giving them pain years later. And it's just, they just need someone to come in and just talk to them and educate and let them know what is going on. I remember many times in the hospital, in labor, wanting to know or ask questions about my care, but being dismissed by my own care, and I'm being dismissed by doctors like, we're just going to handle it. I can't find out what are my choices, what are you discussing? No, I'm just being dismissed, like, this is what's going to happen. And so doulas are so important to be in there and be able to even ask questions and relay that back to the mother, like, this is what they're saying, this is what they're talking about doing, and to help get them a little clarity in what's going on in their birth and things like that. And so I believe a huge disparity of what's going on is that these mothers are being disrespected, they're being left in the dark. They know things about their body that maybe they haven't even been asked about, and then the doctor goes and does something, and they haven't even taken the time to really fully ask them or hear their questions or hear what they have to, what's going on. And really quick before I finish, I'm also a postpartum doula on the postpartum side. And I feel that is a huge prevention. I know of the earlier conversation of the SIDS or the SUIDs. And I go in after the mother comes out, and not only do I sit with them and I'm talking with them, I'm helping them get out feelings and things going on, but I'm also there to, help them with their baby, mother to mother, to let them get rest, make sure they're eating properly and things of that nature, because that's so important. The postpartum period is so extremely important. My sister passed away a week after she gave birth to her 5th child, and she had aneurysm, but she was having all different types of issues that I believe would have led up to, if they would have taken the time to really find out what was going on with her, that could have prevented this happening to her. And she was only 30 years old. And so this is so vital, especially with doulas. And they started the program in New York about the public funding for doulas. And I really wish that Illinois would make some kind of efforts to doing that as well. So thank you so much. Thank you for allowing me to speak and be on this panel.
Thank you all. And I just want to say that I promise you this is not going to be our last conversation on doulas.